Namaste everyone, I am Neha GUPTA, student of MBBS first year. Today, we are going to study about the great saphenous vein and the short saphenous vein. Veins of lower limb have been categorized into two parts, superficial and deep veins. In superficial veins comes the great and the small saphenous vein, and deep veins comprises of medial plantar, lateral plantar veins, dorsalis pedis vein, anterior and posterior tibial vein, peroneal vein, popliteal vein, femoral vein and its tributaries. So let us study about superficial veins. So the long saphenous vein starts from the dorsal venous arch. Here in the diagram we can see that this is the dorsal venous arch which lies at the dorsum of foot over proximal parts of metatarsal bones. There are 4 dorsal metatarsal veins and each is formed by union of 2 digital veins. So the long saphenous vein starts with the dorsal venous arch, then there is union of medial marginal vein with the medial end of dorsal venous arch. It then passes upward in front of medial malleolus. So it passes in front of medial malleolus, then crosses the lower 1/3 medial surface of tibia, and then it goes to the back of the knee, which is very clear in this diagram. This great saphenous vein reaches the popliteal region, that is the back of the knee. Then in the thigh region it inclines forward and pierces the cribriform fascia and enters into the saphenous opening. Great saphenous vein inclines the thigh and reaches the saphenous opening. Then it continues as femoral vein. Now talking about the short saphenous vein. So it is formed by the union of lateral end of dorsal venous arch and lateral marginal vein. The short saphenous vein lies at the lateral side and formed by the lateral end of dorsal venous arch with the lateral marginal vein. Then the short saphenous vein passes behind the lateral malleolus. Then it ascends till the lower part of popliteal fossa. Here, piercing the deep fascia, it opens into popliteal vein. So let us see some comparison between the long and the short saphenous vein. Beginning of the long saphenous vein is towards the medial end of dorsal venous plexus and short vein towards the lateral end. Position. So the long saphenous vein is anterior to medial malleolus, whereas the short saphenous vein is posterior to lateral malleolus. Long saphenous vein has more valves. Thanks for watching.